Hello, my name is Tim Theologis, and I would like to present to you this work that we did at Oxford, and acknowledge my collaborators, particularly Hajar, who did most of the investigation work on this project, and who did her PhD at Oxford through this work. First of all, I would like to stress the importance of core outcome sets. These are agreed sets of outcomes that are to be used in all clinical trials in specific areas of healthcare as an absolute minimum. The reason why we need core outcome sets is because we need to develop some consistency on what outcomes we measure and when, after doing research in a particular field, in order to avoid reporting bias and also to enable synthesis of results and systematic reviews. Most importantly, we need core outcome sets to make sure that the views of the patients and the carers of children are all heard, and we're not just reporting the outcomes that we as health professionals think as important. So we followed the principles of the COMET initiative, and I would strongly encourage you to visit their sites to see what work they're doing, which is quite remarkable. So as part of this process, we did a scoping review of the literature, review of the qualitative literature in the field. We interviewed stakeholders to see if there were outcomes that are not covered by the literature, and having accumulated all the potential candidate outcomes through this process, we undertook an international two-round Delphi process and finally a consensus meeting. And this was truly international in that we got involved people from the 5 continents to express their opinions on what outcomes should be measured in children who undergo surgery for the lower limbs in order to improve gait in cerebral palsy. We managed to get a fairly broad representation of health professionals, and we managed to engage patients and their families in telling us their views on this subject. For the Delphi process, we used a 9-point scale, allowing people to vote the level of importance they thought a particular outcome deserved. So from 7 to 9 were important outcomes, from 1 to 3 non-important ones, and the ones in the middle were important but not critical. We undertook this online survey with the pre-agreed principle that if an outcome reached over 75% of votes in the top 3, it would be a consensus in outcome. If more than 25% were voting in the lower scale, it would be a consensus out. And these are the results, and this is how we separated the outcomes that the majority of stakeholders thought were important to include in this process. Following that, we did a consensus meeting with 21 people representing the same health professional disciplines, and as well as patient and parent representatives. And through discussion, we developed these 8 core outcomes that you can see on your screen, and you see that a lot of those have to do with physical activity and participation, as well as quality of life, rather than the usual sort of body structure measures that we tend as clinicians to measure in our work. We're now in the process of matching these outcome domains to specific outcome measurements that have sufficient functionality and construct validity and reliability to be used in this domain. This work will be reported separately in due course. So in conclusion, In children with cerebral palsy, where results on lower limb surgery to improve gait are reported, it is important to consider that these 8 outcome domains should be consistently reported in all future research work. So we are here to spread the word around and make sure that researchers in this field are aware of these core outcome sets, and that they will hopefully use them in the future to reach some level of consistency and allow systematic reviews and synthesis in the future. Thank you very much for your time.